Coming up on Here's to Your Health, we visit the Blue Zone in Costa Rica for an inside look at ancient healing practices still being used today. Then learn about a consulting and professional staffing firm that's employing a people-first mission to promote wellness. Plus, exploring new frontiers with a customized approach to reaching your goals and tackling life's challenges. Then, WEconnect with a free app that guides and empowers individuals in their personal growth and recovery. I'm Dr. Drew, and you are watching Here's to Your Health. During the pandemic, it's estimated overdose rates have gone up by more than 30%. Well, mental health and substance use disorders have increased due to isolation, plus grief from COVID losses, economic insecurity. It's bad, right? Now, our next guest stresses the importance of human connection. Connectedness is crucial for helping individuals stay in recovery from substance use disorders, and she understands well because she has been there. WEconnect CEO and co-founder Daniela Tudor joins us now to share her story and your solution. So, for me, I have particularly my chemical dependency counselor peers, we've been for years now saying, we got to reach the young people, particularly through the phone. They're so accustomed to the phone. We got to have something where we can use the phone to deliver feedback and services, and you guys developed it.
Yes, and thank you so much for having me on. So as you mentioned, this comes from my personal experience. I'm a first-generation immigrant here in the U.S., and I had a number of traumatic events and life history happen throughout that experience. And the way that was manifesting was through addiction for me, through substances, overexercising, overworking. And then when it all came to a head was when I got a DUI, which I got arrested for, and then I missed my arraignment to my DUI. And so I landed in jail, and I remember being on the cold floor of the jail there thinking, I don't know how to live with substances, but I also don't know how to live without them. And I finally opted to go into treatment. And that 28-day program is how I recognize the 3 barriers that people face to recovery, which led to the founding of WEconnect.
So much of it is the aftercare, right? We sort of send people out into the world with not a lot oftentimes. That's where they fail. We expect them to do better with just a few weeks of sort of essentially going through a car wash. It doesn't work like that.
No, it doesn't. And so at the end of that 28-day program, when I got a piece of paper and it listed all these things I'm supposed to do, meditation, therapy, all of this, in order to stay in recovery, I knew I had to do something about it. And so I recognized that lack of connection, lack of accountability, and lack of a reward needed to be created into a simple-to-use app that anybody could log on to and access connection and all of those things.
So you can get it through all the app, wherever you get your apps.
Yes.
You get feedback from the app, and you also get connection to an actual peer counselor, which is really so critical, the human piece of this.
Yes.
Brains heal other brains.
Yes. Yeah. So you're able to connect with a peer counselor. You can access one of our online meetings, which we instituted during the pandemic, where 750,000 over folks have accessed those. And when you check into your activities, you actually get rewarded for it.
And you guys are evidence-based. You have data. Tell us about the data.
We do. It's been incredible. So we also partner with health plans, employers, and institutions, not just the free offering to the consumer. And so through that, we've actually done multiple studies, one of which that demonstrated that we've been able to decrease emergency room readmits by nearly 15%, increase access to medical assisted treatment and refills to medically assisted treatment by nearly 35%, and then also increase by 70% people attending appropriate use of physicians' appointments.
Yeah, this is the problem that the healthcare system is facing, and you guys are solving that problem with technology that, again, particularly for young people, they just are so comfortable with. And we all should be, because it's a more efficient, more effective way to stay connected, stay with the program. Well, we sent our correspondent, Aubrey Aquino, to sit down with one of your peer recovery specialists who has her own recovery journey. Take a look.
Dr. Drew, when it comes to substance use disorder, it doesn't discriminate, and it can affect people from all backgrounds and life circumstances. This is Sheila Powell's story.
I found this space online. I don't know where I found it, probably on social media somewhere, and it said an all recovery meeting, and it was hosted by WEconnect and a few other organizations, and I logged on and I instantly felt like I was at home. Those are my people.
Sheila actively attended meetings using the WEconnect platform during the pandemic when she was laid off from her job and decided to put her skills and unique experience to use by applying for work at the very place she relied on for recovery.
I wanted to work with people. I wanted to help people become the best versions of themselves. I wanted to help people achieve goals and make positive changes in their life. I applied to become a peer recovery support specialist at WEconnect, and I got the job. And that's what, like a year and a half ago, which seems so wild to me. So I've been a peer at WEconnect ever since, and I get to work one-on-one with people digitally over an app, which is so cool. And I have found my new career path, I have found my new passion, and it's just wonderful. It really is.
Sheila says her recovery is still a work in progress, but it's in giving back and being part of the support system she's needed is exactly where she needs to be.
I love getting up every day and going to work, and not just helping people with their recovery, but it's just the people I work with. Like, my supervisor's amazing, and he actually cares about my goals. He cares about my recovery plan. I care about them, and I care about if they want to make changes, make positive changes in their life. And I'm there for them when they want to achieve a goal, and I'm there to cheerlead them and motivate them and hold them accountable. So it's definitely more than a paycheck, and it's my passion, truly. Like, I can honestly say that authentically, this is my passion. I'm ending my career in this field.
Well, congratulations. You know that when the healthcare companies, insurance companies are signing up, there's a reason.
Absolutely. I mean, the high costs of emergency room readmits and those types of things equate to people not doing well.
Yep.
And us being able to get this in the hands of as many people as possible through these partnerships and directly free in the App Store is what's going to help people.
Well done. Don't go away.